Okay, let's just have a class. We will continue to talk about the human pathogen, and today we will be also talk about the sexual transmitted disease and the related pathogen. So that's very important for the everyday life. Now we spending lots of time talk about the Clostridium, and it's a big topic. It's also related to the canned food. So let's do a very brief review. So we had a Clostridium. So Clostridium is like a genonym. And the Clostridium, they are all gram-positive, rods shape, and endospore forming bacteria, and also it is anaerobic. Strictly anaerobic bacteria, they can grow with the presence of oxygen. And then we mentioned about 4 very harsh, or we say harmful Clostridium, which is the first one is Clostridium botulism or botulinum. And this is usually related to the canned food. So we talk about food botulism. Then we talk about the infant botulism. We should not feed the less than 1 year old kids honey. And we also talk about wound botulism. The second one is Clostridium tetanus. Clostridium tetanus is in the opposite way to damage the body. So botulism, usually we say, is a muscle relaxing, completely muscle relaxing. And tetanus is the toughness of the muscle we call lockjaw. The reason is the neurotransmitter to regulate the muscle relaxing is being blocked, and the vice versa for the relaxing. Clostridium tetanus, I mentioned we shouldn't be a problem because we have a DTaP vaccine should protect that one. And the third one we mentioned is Clostridium perfringens. Clostridium perfringens will cause a very typical symptom, which is we call it a gas gangrene. And we mentioned it will have a double beta hemolytic on the blood alcohol. And we should be avoid 40 to 140 degrees Fahrenheit. We call this is dangerous temperature zone. Because in this temperature zone, everything could grow, and the endospore bacteria will be grow dramatically, especially when the temperature close to 140 degrees Fahrenheit. The mild heat will killing all the vegetative cells, then let the endospore bacteria growing. The last one we talk about is Clostridium difficile. And this is one result from very intensively using antibiotics for about a week, curing the natural flora in the intestinal area, and led Clostridium difficile to dominant. And this is the one we also call it CADIF, the acronym. And what is the typical symptoms? It's called pseudo membrane colitis. And I said that the treatment is very ironic, which is including we could using lactic acid fermented products. Let's say dairy products, yogurts, to put normal bacteria back. We could also using another antibiotics, like using vancomycin instead of using penicillin. But if it's severe symptoms, we have to do is we call it very horrible, seems like fecal implant or fecal transplants. Okay, so this is what we did the conclusion for these passages. Now, by the way, after today's class, we almost gonna finish this section. And I want you guys, after class, you could reading what we posted here. I just posted, which is 3 after class reading material. Like I said, you're non-major students, you don't need to remember, but you should definitely read. The major students, they have to remember. So let's say, we talk about here is gram-positive coccell. What is gram-positive coccell? What is called the Rebecca Lansfield group? What is alpha hemolytic streptococcus? And what is beta hemolytic streptococcus? And very important, you can look at these case studies. And these case studies will be exactly move on to the exam questions. Because this is what you learn in your real life. What of these passages will be related. So you can do a pre-review by yourself. And I will have a time next week, Tuesday, we're going to go over lots of these case studies. And here is a conclusion table, which is quick guide to the organisms. You will see all these things, what they are talking about. Then we move to Staphylococcus. Same thing. And for Staphylococcus, we also have a case study here that you can study for that. And like I said, for you, you only need to read through. But definitely remember, this material is important for your open book exam too. So absolutely you should download it in your notes, in your personal iPad or whatever you have. So for example, I have a second section which is talk about corynebacteria. So what is corynebacteria? Diphtheria toxin. And then we go talk about the case study. We're going to go over this one next week, Tuesday. The Klebsiella. Then we talk about the Haemophilus influenza. And then we also mention about the case study. So this is important. So Buddha purposes we haven't, we mentioned briefly. But here is the information. And also for the after class reading 3, you also can see we did this. I did the same for all the other sections. This time we'll be fully focused on his Clostridium, which is we just talked about. So Clostridium difficile, and we had Clostridium botulism, and we also had a Clostridium tetani, Clostridium perfringens, and the Borrelia. So these things, I'll just remind you, please read before the exam, which is highly help you to do that. Okay, now we left some of the passages in this table. We haven't mentioned too much. So we want to go over these today, then move on to the next slides, which is we talk about sexual transmitted disease. So this slide looks like tedious. There are lots of the passages there, all of a sudden it comes out. This belonging another class. This slide alone belonging another class, which is called food microbiology. So Dr. J teaches that class. It's a major class for food science. We're going to go over all these human foodborne pathogens. But here we'll just be very briefly to mention to you. Salmonella typhimurium, of course, will cause salmonellosis. And the major contamination is poultry eggs in the animals. I want to make sure there is something you know. Every microorganism that could contact any food products, any human beings and any animals and plants even. It does not mean I listed here is infection. It will not happen on the other subjects. It will all happen, but why we list here? Because in the history, these are the major resource for the infection has been caused outbreaks or major recalls has been reported by CDC. the Centers for Disease Control and Prevention, or sometimes FSIS, Food Safety Inspection Service, from under the USDA, the Department of Agriculture. So that's why we say the source of infection. Salmonella typhi, typhoid fever, water and food. So I want to mention several things very interesting. When we talk about salmonella, regardless what is the subspecies here, remember in the very first class I said, salmonella, when you're writing, it's special. The genus name, the species name, lots of the time, let's say, is Escherichia coli, let's say. These two are all italic. But salmonella, let's say salmonella Newport, this is normal. Why? Because ideally it should say salmonella enterica, subspecies enterica Newport, and this section is italic. But the people think this is too much words, it's very wordy, and they also think you guys are smart, so they remove this part. So therefore, why Newport is a normal font, the reason is this is a subspecies name. But at the same time, we also want to say, any of the salmonella related to the foodborne pathogen, it is non-typhi. Salmonella typhi is a completely different story. Salmonella typhi, you are talking about is a very magical woman in the history, Typhi Mary. We call Mary Maron. The lady is born around the 1910s. She worked as a bookkeeper, like an accounting job in the New York City. So one day she had like a cough, fever, sneezing, those symptoms. She go to work. Couple of days later, people surrounded her started to die. So she has to find a doctor, go to see a doctor, and even in isolated like a special places. Then a couple of years later, she recovered. She go back, need to work. So she worked in a kitchen, in a food preparation restaurant. One day she also had a sneezing, coughing, and all those symptoms, and the people surrounded her also died. And later on in 1930s, to the rest of life, the NYPD has to put her in the custody until she's dying. So she, because of like a resource of the contagious contamination, she has to be out freedom for many, many years. Then later on, until 2003, even after she died, about like 40 years, the medical scientist in Stanford University to do her body and find that in the spleen there is a macrophage. And the macrophage protected the pathogen is called Salmonella typhi. So, if we talk about Salmonella typhi, this is related to the history of a very magical woman in New York City. It's not her fault. It's just be very dramatic. It's very magic. Now, when we talk about today, even in our exam 3, we talk about Salmonella Newport, Thompson, Typhimurium. These we all say it's a non-typhi. Non-typhi Salmonella, they are mild risk compared to Salmonella typhi. So just something I want to be mentioned that. The next one is vibrio chloral. We're going to mention real quick. Vibrio chloral usually is in the seafood. This will cause you dramatically losing water in a couple of hours. You can lose 6 liters to 10 liters of water in the body. So, vibrio chloral, if we want to do the treatment, the first thing what we need to do is rehydration, which means put the water back to your body instead of give you antibiotics. Of course, we need to give antibiotics. Shigella. Shigella usually related to is daycare kids. That's a very interesting one. Shigella have the same thing as E. coli 0157H7 because of the Shigella toxin. But it's more related to the daycare kids, which means they're like toddler or less than 5 years old. And when they go to the restrooms, after doing potty or poop, they didn't really clean the hands very well. If the babysitter didn't watch very carefully, then they touch everywhere, and then they get contaminated. The other people get contaminated. So that's Shigella. Campylobacter jejuni, we're going to talk about in the exam 3 related to the poultry. This is the bacteria only need 5% of the oxygen they can grow. More oxygen will kill them. It's very difficult to grow in the lab for the research, but it's a foodborne pathogen secondary to salmonella on the poultry meat. So E. coli. When we talk about E. coli, there are lots of information we can talk. It's not very simple. Like I said, in the very early class, if you just mention E. coli, does not mean it's a harmful bacteria. We have generic E. coli. Generic E. coli, you can say it's normally existing in our body, especially the fecal sample. So, but if generic E. coli is existing in the municipal water system, this will be counted as fecal contamination. But basically, it's normal. Our major issue is E. coli 0157H7. This will cause Shigella toxin. Will be damage the kidney. So we will mention this in the exam 3. That's a foodborne pathogen. In the United States, this is zero tolerance in beef products, which means they not allow you have one single cell. E. coli is also the major pathogen will cause urinary tract infection, which means you have a dysuria, which is feeling difficult to pee. At that moment, we call urological E. coli. That's a human pathogen. It's not really a foodborne pathogen. But at the same time, it also could be used during the fermentation. So for example, E. coli 9037, this will be the pathogen using in the food fermentation process. So just want to let you know, when you see E. coli, it really related to what is their serotyping. It does not mean it's really a pathogen. It could be just normal bacteria. Let's say here the E. coli, I don't know which one they mentioned, but they cause traveler's diarrhea. And E. coli also have 4 different categories. We call it entero-invasive E. coli, pathogenic E. coli, toxication E. coli, and hemorrhagic E. coli. So lots of the categories for that. Yersinia, the next one, will cause enterocolitis. Milk is a resource. So we had a debate in West Virginia about legalization of unpasteurized milk. So lots of people want to drink the milk which is unpasteurized, which makes sure there's a high nutrition there. Okay, so that is the Yersinia. But Yersinia, the most horrible food resource. It is actually is for the chitlings. Which is pig intestinal. And you guys don't eat it. In the United States, usually this is as a byproduct used for the casing of the hot dogs. I sometimes eat it. If you go Pittsburgh, go to Forbes Avenue, there are a couple of the Chinese restaurants. You can get one bowl of the chitlings, the pig chitlings, about like $20. Well, those are well cooked. If it's not well cooked, then Yersinia will be a good resource for the contamination. Listeria monocytogenes, we're going to mention later on. That is a very harmful pathogen. The big thing for the pathogen is it grows in the refrigerated temperature. Vibrio parahemolytic cause hemolysis, also called paralyzation. Clostridium perfringens difficile, we already talked about. Okay, here is another big thing regarding to our everyday life is a plaque formation for the teeth. So some of you will be like dental school, go to the dental school, a dentist in the future. And after our bachelor degree in animal science, for example, you may go to the dental school. One of the things we talked about here is how the plaque will be formed. Okay, so first of all, sucrose. So what is sucrose? So sucrose, we talk about, it is a disaccharide. It's composed by glucose and fructose. So if you wanted to know the chemical structure, glucose looks like this. Looks like this guy. And the fructose, it looks like this. That's a chemical structure. This is H. Then they connect it together. We call it 1,2 glycosidic bonds. And remember, sucrose is not a reducing sugar. So that's sucrose. Sucrose usually widely existing in our daily grain products, let's say rice. So the story is that teeth problem, usually the plague, rely on two things. One thing is the genetics. So usually if the parents have really bad teeth, usually the daughter or the son, the next generation, usually will have the same thing because of the genetics. Second is the diets, what you are eating. So let's say I'm from Asia, from China, from Asian countries, we eat rice. So rice have lots of sugar, and the carbohydrates, one of them is the sucrose. So once we eat the rice, of course we have to do dental hygiene, like brush the teeth all the time. It will be recommended you do twice, but some people will say you have to do 3 times. If we don't do it, what will happen? Remember, we talk about streptococcus. Okay, let's say these are the teeth. I just draw like this. This is what we call is oral cavity. In the oral cavity, there is widely present one type of the bacteria, we call it Viridem streptococcus. Now, Viridem streptococcus, you can understand, is very different types of streptococcus. And streptococcus mutans is one of that. So this is surviving. Let's say. Okay, now, if I eat rice, I did not clean it. What happened? You have some sugar there. You have some sugar there. These are sucrose. And in our teeth, you know there is not much oxygen. It's close to anaerobic environment, which means limited or very limited oxygen. So under very limited oxygen, you have a bacteria grow there. You have a sucrose there. Sucrose is very easy to break down and becomes glucose and fructose. Then very natural, they're going to go through a process called fermentation. And what's the product after fermentation? Think about is acid. That's really bad. Once the acid generated, especially like lactic acid generated, what happens? They will be to do demineralization of the animal, then cause the tooth decay. Now we mentioned earlier what happened is if you do not do a very good job of dental hygiene, the bacteria could be stick there, become a matrix we call biofilm. So think about it, if you do not brush your teeth for 3 days, just imagine, then the bacteria will have a matrix there. It's more difficult to remove because for the biofilm, they resistant to sanitizer. So that is a story, talk about like plague formation, how they do, is we daily take some of the sugar from our diets. And then they will go through fermentation because our teeth environment is anaerobic or very close to anaerobic. And one of the bacteria could be dominant there is Streptococcus mutans because it's a very damn Streptococcus. And fermentation generates acid. Acid will go through demineralization and will be demineralized animal, which is cause the decay and forming the plague. Okay, so that's something to talk about sucrose and the plague formation. Chlorophyll, we just mentioned. It's like the name, what they call the vibrio. It's a common shape. It's a common shape. It's gram-negative bacteria. Usually the seafood, especially shellfish, is a natural reservoir, and it will generate a toxin called collagen. This is what happened. You will lose water immediately. Have a big diarrhea. The sample looks like rice water. So what we have to do, oral rehydration, antibiotic therapy immediately. Now a little bit of mechanism here. So originally we keep the balance of the sodium. That's why we need to drink water all the time. If contaminated with chlorine, you have enterotoxin goes there. The enterotoxin will activate adenine cyclase. They will forming cyclic AMP, then block uptaking the sodium, and then the osmotic balance is being damaged. What happened in the lumen cell, the sodium chloride concentration will be increased and dragging lots of the water to cause the diarrhea. So this is something I always talk to my major students. In other classes we talk about. So everybody knows ATP. You heard about it. So what is ATP looks like? We can just draw a very simple structure. Looks like that. Then go here. Then go another phosphates, okay? Let's say this is ATP. Adenine trifolic phosphates, that's ATP. This is good. ATP is an energy currency. But what happened? If somehow there is an enzyme called cyclase comes, This got to connect it to here. Then ATP is no longer ATP, becomes CAMP. What this looks like the money is in your pocket, has been locked. You cannot use it. That causes all the problem. All kinds of the disease, lots of them. Like our mucus come out during the infection of the streptococcus, is all because cyclase has been activated and ATP becomes CAMP. Same thing here. The enterotoxin has been activated adenine cyclase. So CAMP has been formed, then they block uptake of the sodium and sodium chloride dramatically increased and dragging the water into the lumen and then cause the diarrhea, the severe diarrhea. Okay, so that's a corollary of what it talks about. So we finished the talk about here. This is basically the human disease caused by the bacteria. Okay, now we're going to go to the next one. This little horrible, some slides, so we want to talk about that. The next one we want to talk about is some other human disease caused by the bacteria. We want to first talk about sexual transmitted disease. And then we finish talk about the others. Some of we already talked. We already briefly mentioned, but we want to emphasize a little bit more here. First of all, sexual transmitted disease. We just say STD. This is a global public health risk. And unfortunately, I would say undergraduate is a risk group. So that's why every year we have the lecture about this. We usually one lecture talk about sexual transmitted disease and the pathogen related to that. And I usually just only talk about two. There are a lot. Sexual transmitted disease, 95% of the time is from male transferred to the female from sexual activity. That is well recognized. Second, sexual transmitted disease, around 70% is asymptomatic, which means you could be in certain stage of the disease but did not show any symptoms. If people continue to do sexual activity, it will transfer to the other person. Or we say transfer to the partners. Number 3, there is no effective vaccine for STD. So that being said, it does not mean you took a shots or took a boosters in certain day and in the next period of time you can do whatever you like. There is no certainty in the world. So there is no effective vaccine for the STD. The reason is, major reason is because sexual transmitted disease related pathogen has lots of mutations. So you don't have those vaccines, we can be very targeted. Number 4, there is no immune or no strong immune memorization. What this means, if you get a sexual transmitted disease one time, does not mean the rest of your life will be free. It could get repeated again the same thing. And sometimes the pathogen could be in your body for a very, very long time. We don't have a very strong immune memorization. Therefore, people always say sexual transmitted disease, it is a social science versus medical science. Which means the social scientist will say the education is important as a prevention strategist. Medical scientists will say we need to develop more effective treatments and the vaccines for that. So this is always a debate. This is my question. Usually for major student, if you take my AEM 341 general microbiology class, that is extra points for the final essay writing. We want to talk about, have a debate issue. Which one is important? Okay, so that's overview for the sexually transmitted disease. You can see here, it's a severe, major public health problem. About 300 million new cases a year. And it has been there for thousands of years. And the more risk group is 15 to 20 year age group. So we want to talk about several things. Number one is gonorrhea. The first one. The second one, we want to talk about syphilis. Okay, there's so many. We just pick two. So gonorrhea. Gonorrhea will cause Neisseria. Gonorrhea. Neisseria gonorrhea. Same as Neisseria meningitis. It just the species name is changed. So, what it looks like? Gram-positive, rods, and coffee bean shape. Or we say coccobacillus. Neisseria gonorrhea, same as Neisseria meningitis, it's a fastidious bacteria. What means fastidious bacteria? In the clinical area, we're using three agar. Macanthi agar, there is no grow. Blood agar, with 5% shea blood, it's not grow. Chocolate agar, it grows because that's 5% shea blood agar heated at 70 degrees Celsius and turning brownish, which is we call chocolate agar, chocolate-like agar. So it's a fastidious bacteria. But on the chocolate agar, it's very easy to be recognized because it is a pushable colony. So the characteristics is very good, and the symptoms is also very easy to be recognized. In the male, the penis will have urethral discharge. In female, vagina tract will have abnormal discharge or bleeding, on period of time bleeding. So it's very easy to get it. Now we want to talk about is the male and the female, the diagnosis process is a little bit different. So for the male, what will happen is you could get the discharge from the penis and then go to do gram stain. If the gram stain you find looks like the picture, surrounded by red blood cell or white blood cell, but it's coffee bean shaped, gram negative, and the coccobacillus, that's gonorrhea. And then we will use a sample to confirm on chocolate agar to see the pushable colony, and then using PCR methods to rapid testing. For the female, we can do this section. We can do gram stain. Why? Because the discharge from the vagina, there are lots of other bacteria, especially gram-positive lactobacillus, will be dominant, and even some fungi. So, like a candidate, albicans candidate. So, For female, we will directly streak plating onto chocolate agar. And we find the colony, then we do gram stain to confirm it. So that's how we diagnose it. So one more thing happened for gonorrhea. It's not stay in the adults. It is also will be transferred to the newborn. If you see a baby looks like that, that's not the skin infection of the eyes. It's conjunctiveness. It's very possible the Neisseria gonorrhea has transferred from the mother to the newborn baby. So that's some high risk for that. Another thing what we can do is a very quick test is we call oxidase test. Oxidase test is usually in the paper. We add a bacteria, we add a couple of the drop of the oxidase reagent, and it turns purple color, then it is positive. So that's oxidase test positive. We can using using a biochemistry test to do a very fast determination. So that's a gonorrhea. But how are we going to do it? Slightly, basically we say we don't have much can do the treatments. It is also pretty invasive. It could be involved in the jaws, heart, and throat. So what we do? Using antibiotics, of course. We can use penicillin, but the penicillin is using way too much, so there's a penicillin resistance happen. But like we mentioned earlier, the public education, especially lots of people are asymptomatic, the condom use and the quick diagnostic is important. So education is more important than the treatments. So that's for the gonorrhea. Second thing, syphilis. That's some major history disease. So here is the thing. There are lots of the sexually transmitted pathogens. When we talk about gonorrhea, we talk about chlamydia, all kinds of things. The oldest and the most important pathogen happened even 1,000 to 2,000 years ago is syphilis. Syphilis, first of all, we should know, we already mentioned that. Treponema pallidum. So what is this one? This is spiral sheets. Asexual filament, endoflagella for movements. Because it's a spiral sheets, remember, we cannot use gram stain. But we have a tool to do the direct diagnosis is dark field microscope. So what is dark field microscope? If you forgot about this, underneath the condenser there's a block. So the light going through perpendicular. This is used for diagnosis syphilis, for Treponema pallidum. This is the oldest sexually transmitted disease in the world. It has been there 2,000 years, started from Asian countries. I hate to say that. There are 3 stages. In the first stage, you often have ulcer in penis or the skin. This is called chancre, a French word. Once you have this, what happens? It's about 2 to 7 weeks. Now what happened? This will disappear. That's a bad thing. The ulcer will go. So you think you're recovered. Some people even using some of the ornaments like a skin medicine. That's gone. So if people continue to do sexual activity, of course it's going to transfer to the others. The second stage. the whole body rash. That's called guma. That's the second stage. The picture there is guma. That's the second stage. Tertiary stage, neurological symptoms. Could be invasive. Secondary stage, that could be a couple weeks, couple months to a years. The third stage could be 15, 20 years. It could be somebody carry on syphilis the rest of their life, but for himself is no risk. But it could be a good resource to do the infections for the others. And honestly to say, syphilis, not really much we can do. Early stage, use antibiotics, but if you feel follow-up to do, there are not many effective ways to do. There's no vaccine for that. Public education is important. Sexual hygiene, use the condom, that's the only thing we can do. I mean, that somehow is belonging to the social science. So that's the syphilis. And the same as gonorrhea. Syphilis could also, through the fetal, go into the newborn baby, the urethra. So it could be transfer from newborn, the pregnant woman to newborn baby, we call congenital syphilis, same as gonorrhea. Okay, so that's syphilis. Next one, we want to talk about Lyme disease. That's the last slide here. Talk about Lyme disease. So this is something we already mentioned, but we want to talk. So remember, at the very beginning, we talk about dark field microscope. We said the dark field microscope is very effective to identify a special bacteria called spiral sheets. And we mentioned about the syphilis, Treponema pallidum. Another one is Borrelia burgdorferi. Borrelia is a genus name. Burgdorferi is a species name. That is from Dr. Burgdorferi. Dr. Burgdorferi is an American microbiologist professor at Montana State University. Back in 1970s, he is the first person isolated Borrelia burgdorferi as a pathogen for Lyme disease. So what is Lyme disease? This is coming from Lyme County in Connecticut, New England area. The typical symptoms is very unique. Everybody will see the bullseye or target rash. It's lots very itching sometimes. If you have those symptoms on the arms, need to go to see a doctor. We'll be using PCR or other methods could be diagnosed as a Lyme disease very quickly. The pathogen Borrelia burgdorferi. So you can see what happened for the Borrelia burgdorferi. Most of the time is in the New England area. That is a survey a little bit older. It's about like 100-year survey from 1907 to 1996. That area, a little bit of Florida area. Not in West Virginia at all. We don't have really a river. Not in the Central America. Okay, what happened? Lyme disease, first of all. If you are doing lots of aquatic activity, like fishing, especially use a deep ocean fishing, diving, then annually you have to do the screening test for Lyme disease, for Borrelia burgdorferi. But in the real life, It is a 2-year program to grow. We already said spiral sheets is an obligate parasite. Looks like, it's not a parasite, it looks like an obligate parasite. So they need a host. So what happened? They had a larvae comes out, and the mice could took it. In the mice body, the larvae could become a ticks. So the larvae could become ticks. And very typical isodex ticks. And the ticks will be contaminated from the mice, will be contaminated a deer. And the deer, the fecal sample could be contaminated by a mice again and go to the environment. If a human being has been contaminated, which means the skin surface is contaminated, because it will be very easy to be penetrated. Human being will be the final host. So what are we going to do? We can do some of the control. You can clean all the leafies. There's no way to do it, especially in the forestry, in the forest. There's no way you kill all the mice. Of course, you're not going to kill the deer. Although we can do deer hunting all the time. What we can do? We can only do is isodex ticks control. So the isodex ticks control is important to prevent the Borrelia burgdorferi for the Lyme disease, but it's very difficult to do. Especially lots of the medicine using for control, or we say sanitizing, has already become resistant. So that is the Lyme disease. What we do is serological testing, treatment, prevention, control, antibiotic therapy, avoid the ticks. Those are the things we pretty much can do. So, until here, we finished all the pathogen and related to the human disease we talked about. So overall, we talk about a lot. And next class, we will be doing some of the review, have some of the case study as a practice when we prepare for the exam too. Okay. But again, we're going to continue to talk about that. Also, next week, Thursday, we'll have our first guest lecture. And I'm also going to send an email to everybody. I usually offer 5 points, additional extra points for attending guest lecture. Because lots of you non-major students, you're not very good at taking the exam of those science, especially like this microbiology science. So we give you the extra points to attending guest lecture. The first guest lecture will be Natty Fresher and teaching professor in our school. He'll talk about lactic acid bacteria, beneficial bacteria related to nutrition. It will be next week, Thursday, the same time. And I'm going to send an email to everybody, okay? But I'm going to give a very brief opening remarks, talk about what's the next topic. So we talk about these human pathogens. Streptococcus, staphylococcus, Clostridium, syphilis, all these things using 2 classes real quick. A major class usually took a little longer time. But what are we going to do? We have to do the treatments. The treatments, what we do? We using antibiotics. For example, penicillin. We heard about that. You know that. But the question is, first question is, what is antibiotics? Antibiotics said very simple. It is metabolic products from one microorganism used to kill or inhibit another microorganism That's called antibiotics. Most of the time, this one microorganism is fungi. Let's say penicillin is coming from a fungi called penicillium, and this another microorganism usually means bacteria. Not necessarily all the time, but most of the time. How we say Q, it's cyto. What means inhibit? Static. So that is a very simple definition. At the very beginning, antibiotics is natural. However, today, in the medical area, you're using the antibiotics is chemical synthesized. So in the history, it is natural, should be. But there's a one exception. Sulfur drug. Sulfur drug is natural, is chemical synthesized, but we still say it's antibiotics. But all the others, penicillin, rifampicin, gentamicin, kanamycin, all kinds of things, those are natural existing or natural isolated. It's not a chemical synthesized. But today's products, we already add chemical ingredients, so it's a semi-synthesized. So here is some definition. We already talk about antibiotics. We are talking about chemotherapeutic agents. So use synthetic chemicals to treat disease. Antibiotics is one of that. Now what is antimicrobials? It's naturally or chemically synthesized, which is both. Let's say you buy a hot dog. You see the ingredients said sodium diacetate. That is chemical synthesized. It's not natural existing. But penicillin, kanamycin, sulfur drug, and also sodium diacetate or lactic acid, all of these, we call it antimicrobials. Okay, so that's something, the definition. Let's talk a little bit of history. Very beginning, German scientist Paul Ehrlich discovered salvarsan. They used to treatment syphilis. Like I said, syphilis in the older time is equals cancer. Before antibiotics generate, it's really nothing can do. And later on, we can find some way to do, but it's not going to completely to kill everything. By the time in 1912, Paul Ehrlich comes out with a concept called chemotherapy. Today's chemotherapy, most of the time, you talk about is a cancer treatment. That's different. In 1929, Fleming discovered the first antibiotics is penicillin. This is everybody knows. Next one we mentioned the tuberculosis. In the older time, about 100 years ago, I can say tuberculosis is like a lung cancer. No we can do. There is a traditional herbs, traditional Chinese medicine, or all kinds of things people tried, not successful, until antibiotics comes out. The first one is Berge and Weissman discovered streptomycin. That's why today tuberculosis is not really a great risk anymore. At least I never heard an excuse that people not attending because they get tuberculosis. Very few you heard about it. Antibiotics sometimes, it's only effective for certain pathogens. Sometimes gram-negative, sometimes gram-positive. The first antibiotics used in the world, which is broad spectrum, which means both effective for gram-positive and gram-negative, is chloromethicillin. It's called chloroform. It's in 1947. So, start from 1950s, people have a great increase of the lifespan. That's a reason, because we have antibiotics. But we also have the problem, because antibiotics used way too much, they become resistant. And I just off a USDA review panel for all the research. submit a proposal to want to do antibiotic resistant in the food supply chain. And that program has already been there for 20 years, which is a big risk. And I tell you, we did a very small research. I collected a water sample near our Ruby hospital. And I just do a very simple test. I find that the bacteria from the water is resistant to at least 10 different antibiotics we used every day. And the very famous one we talk about all the time, we mentioned, is methicillin-resistant Staphylococcus aureus. That's one good example for antibiotic resistant, because we're using too much. So I give you, I think from this standpoint, the United States did really good. So you can feeling about, if you have a coughing and sneezing, you go to see a doctor. Usually they won't do a prescription of the antibiotics to you, unless you diagnose you have a throat culture. Usually what they're going to ask you to do is get a medicine from the countertop at CVS, and you can recover in 7 days. So most of the time it's a virus. But in some country, antibiotics is used dramatically. You have sneezing, coughing, the doctor will give you antibiotics. Will give you penicillin, tetracycline by the old time. Some of the antibiotics is very effective to kill bacteria, but some of them will have side effects. Let's say you lose a hearing, you have yellow teeth, you have yellow eyes, you have a debone, could be, and some of them even decrease the bone marrow function, which means you red blood cell or white blood cell could be dramatically decreased. So this is the history of the antibiotic therapy. Next week we want to start to talk about the story behind the antibiotics and a little bit of mechanism behind it. So give you an overview what it looks like, what's happened. Okay, so that's all we have today.